Hello, welcome to this week's Tuesday Tip. I'm Dr. Bill Waggoner. The American Heart Association recently published an update to their infective endocarditis prevention guidelines. I thought I would do a brief review of that update for you today. The updated paper was published in the journal Circulation in May 2021, but you can also find the updated information on the website of the American Dental Association in the Oral Health Topics member section of the website. Now, during my dental school years in the late 1970s, SBE prophylaxis was recommended for a multitude of cardiac issues, and it required a loading dose 1 hour before the dental appointment and 8 subsequent follow-up doses at 6-hour intervals. The AAH guidelines today have a much smaller subset of cardiac conditions requiring SBE prophylaxis, and we now only dose 1 time at 30 to 60 minutes prior to the procedure. These guidelines have been reviewed multiple times since the late 70s, and they continue to be reviewed and revised on a regular basis. Now, this is not going to be an exhaustive review, but I am going to hit on 6 key points from the latest update. Point number 1. As I mentioned, the subset of cardiac conditions requiring prophylaxis is relatively small. It's now felt, based on scientific evidence, that the risk of adverse effects of antibiotics generally outweigh the benefits of antibiotic coverage for many of the patients who formerly would have been covered. Concerns about drug-resistant bacteria is also a factor. Point number 2. Infective endocarditis prophylaxis for pediatric patients should only be considered when the child has cyanotic heart disease that has not been fully repaired, a congenital heart defect that has been completely repaired with a prosthetic material or a device, but only for the first 6 months after the repair, and for repaired congenital heart disease with residual defects. Point number 3. The new guidelines point out that data are mixed as to whether antibiotic prophylaxis actually prevents infective endocarditis. They note that people at risk for infective endocarditis are regularly exposed to oral bacteria during basic brushing and flossing. They recommend that maintaining optimal oral hygiene and optimal oral health is highly encouraged for these at-risk patients. Point number 4. When the conditions exist for the need for antibiotic prophylaxis, the guidelines state that it should be used for all dental procedures that, quote, involve manipulation of the gingival tissue or the periapical region of the teeth or perforation of the oral mucosa, end quote. It is not needed for injection through non-infected tissues, for radiographs, for the adjustment of orthodontic appliances, or for placing orthodontic brackets, for the normal exfoliation of teeth, or bleeding from trauma to the lips or oral mucosa. Point number 5. Clindamycin is no longer recommended as an alternative for penicillin or amoxicillin allergic patients. For oral administration, cephalexin, azithromycin, clarithromycin, or doxycycline are recommended as alternative drugs. And point number 6, the recommendations continue to recommend administration of the antibiotics prior to the procedure. However, the guidelines now state that if the pre-op dosage was inadvertently missed, the dosage can be administered for up to 2 hours after the procedure. If you're like me, you have a printed copy of the AAH guidelines handy in your office for reference. Well, it's time to update your copies of the guidelines. I'm sure that the AAPD will be updating the reference manual soon, but as of July 24th, the AAPD website has not yet been updated. So I'd recommend going to the ADA website or the article in Circulation for your updates. Thanks for listening, and I'll see you next week.